After undergoing 2 surgeries to remove fibroids, Elizabeth Korasare struggled to get information to better understand the condition. On realizing how many women were suffering in silence, she decided to start a platform that would help in raising awareness and pointing patients to the right direction in seeking treatment. Her story.
My name is Elizabeth Korasare. I run an NGO responsible for public education in health, awareness creation, support to women in their various communities and rural areas. I'm presently also the Executive Director for Fibroid Foundation Africa, an NGO that some women together set up in 2020 to support women who are suffering from uterine fibroids. I started this foundation because of my experience after a surgery. I had fibroid surgery at the age of 32 when I was going to have my first child. I didn't know that I had been incubating or having fibroids inside me until I became pregnant. So after my surgery and I was discharged and I came home, I was like, I listen around, I don't hear anything on fibroids. Nobody is educating anyone on fibroids. Nobody is talking about it. Basically, I don't hear anything. But I think if we are educated and we are aware, we will rise up to it early if we see some symptoms. So I spoke to a couple of women and we decided that we should start this organization to assist women suffering from uterine fibroids. As our mandate exists to create awareness, so we don't leave any stone unturned. We really reach out to the women wherever they are. We know that most often the marketplaces are places where many women gather. Then we educate them. We have created our own IENC materials and we take them along to explain to them what fibroids are. Most of the times when we go to such locations, some women come out, share their stories, terrible stories with us. So we have a lot of women and their telephone numbers and we reach out to them. We have people also from the Ghana Health Service who help us in our community awareness creation programs.
Fibroid Foundation has a checklist, and I'll ask you questions based on the checklist.
We have been able to identify a few clinics who accept the National Health Insurance card. And for that matter, we direct the women to those facilities. But we don't impose anything on them because it depends on what you want. A few of them who cannot afford at all have been able to have a successful surgery at a very lower cost. When we go out there, we don't leave the men out. Some of the things we tell them is to show some love, is to find out from them how they are feeling occasionally, especially when you are aware that the woman has uterine fibroids. Don't leave that woman out to be on her own. It is through the womb that generations will come. Without the womb, humankind will cease to grow. Because then if women are losing their wombs and they cannot have their babies, then how would we get the population? How would we get the people? You will see so many women walking around having heavy hearts because they get into their homes and because of fibroids, some of them, their husbands do not even bother. They don't care who you are because they see you as just an item in the house. We stand on our slogan that says that a healthy womb makes a happy woman.